Hey, everybody. Good morning. This is Nurse Eunice, and today's live CNA review is for our channel members. So that is right. So we're going to give you a few moments to receive your notifications. And if you're a military veteran or if you actively serve in the military, I want to tell you happy Veterans Day. All right, everybody, let's get this started. We'll give you about 8 seconds before we begin. Handling and resident care. As a CNA, your care directly impacts patient safety and comfort. Knowing how to safely transfer residents, apply gait belts correctly, prevent pressure injuries, and assist with proper diets is essential. This practice test will reinforce safe and effective care in four critical areas. Safe transfers, positioning, gait belts, and also nutrition. So I see you all coming in. Good morning. I hope you're having a wonderful day. All right, so let's begin. Question number one. Before assisting a resident to stand using a gait belt, the CNA should do which first? A, tell the family member to help lift. B, put non slip shoes on the resident. C, put the bed in the lowest position. Or D, lock the brakes on the bed. What do you think, team? I'm so proud of you. We're torn. We're torn. Some of you all want to put the shoes on first. But what if you put the shoes on, but the brakes are unlocked? That's right. So the correct answer is D. Locking the wheels prevents movement and helps prevent falls during transfers. And some of your beds are high tech. Like the bed will start alarming if the brakes are unlocked or if the bed is at an elevated position. And so, if your bed is not high tech, you have to just look before you start transferring your patient. So let's go to question number two. Great job. Question number two. Where should a gait belt be placed? Is it A, around the chest, B, over the clothing at the waist, C, directly on the skin, D, over the thighs? Where should a gait belt be placed? Revealing the correct response in three, two, and yes, that's right. It is B. Gait belts must go around the waist over clothing for safe friction and control. That can be very irritating to a resident's skin. So you don't want to have it directly on their skin. And if their gown is open in the back, you want to close it because, again, that's going to cause friction. And for your elderly population, that could increase the risk of skin injuries such as skin tears. Question number three. When ambulating a resident, on which side should the resident stand? A, the weaker side, B, the strong side, C, in front, D, behind them. When ambulating a resident, on which side should the CNA stand? And that's right, team. Everybody got this right. Look, you're going to be on A. You're going to be on the weaker side. So, standing on the weaker side is the best way to help provide support and to prevent falls. Question number four. A resident becomes dizzy while standing. The CNA should A, continue walking, B, push them against the wall to prevent a fall, C, slowly lower the resident into a chair or onto the floor, or D, run for help. And this is so scary when it happens. So as soon as I get opportunity, I'm going to shoot a video on how to, assist someone who's falling safely. Yes, Andrea. Yes, Tommy, you are right. The answer is C. We're going to safely lower them to a seated position to prevent collapse or injury. So whether that seated position is on the floor or if they're standing, they get dizzy and they're near a chair. Of course, the best option would be to put them on a chair. Question number five. Which position helps to prevent aspiration after meals? Is it A, supine, B, Trendelenburg, C, Fowler's, or D, prone? You got it. You got it. You got it. Yes. It is going to be C. Fowler. So upright positioning helps prevent food or liquid from entering the airway. Question number 6. Why should a resident who is bedbound be repositioned every 2 hours? Is it because A, it helps them fall asleep? B, it prevents pressure injuries? C, to keep the linens neat? Or D, to warm the skin? All right, don't be nervous about taking your test, Anastasia. You're going to do fine. You're studying. You're studying. Just keep reviewing, keep practicing questions. And when in doubt, if there's an area you're weaker in, you can always reach out to your school, to your instructor, or you can, if you have a question, you can always email us at admin@fltraining.com. And we appreciate you all for being channel members. This was an easy one, so I knew you all would get this one correct. Yes, the answer to question number 6 is going to be B. Repositioning helps to relieve pressure, which protects the skin. So that's why we have to change your position every 2 hours or more frequently if your patient verbalizes any pain. Question number 7. A red spot over a bony area that does not blanch or get pale when pressed. When pressed is it A, stage 1 pressure injury, B, stage 2 pressure injury, C, stage 3 pressure injury, or D, stage 4 pressure injury? Look, it's early in the morning. I haven't finished my cup of coffee yet. But what I do know is that before I take my son and his friends to the fair, I was going to get on and spend time with my channel member. So, again, just thank you. And so if you're interested in becoming a channel member, because they get exclusive, they get the first opportunity to be on the lives. Whenever you go to our YouTube channel, which is Florida Training. If you're not already subscribed, it's going to say subscribe. If you are subscribed, it's going to say join. And so the memberships are as low as $4.99 per month. And so they get downloads, they get practice tests. Speaking of practice tests, whenever we're done with this live stream, you're going to, whenever you sign into the comment area, you go and look at the post, you're going to receive a link that actually gives you these slides, but that's only for our channel members. So no one else will be able to see that except for the channel member. So thank you for joining our membership. All right, so let's see. Yes, you have it right. It is A. Non-blanchable redness is the first stage of a pressure injury. And notice there how it says pressure injury instead of pressure sore or bed sore. Pressure injury is more inclusive of the different things that can happen to the skin. It's not always an open sore. So pressure injury is the correct term. Number 8, which area is high risk for pressure injury? Would it be A, bicep, B, calf, C, forearm, or D, coccyx? Oh, this one's a little tricky. I see some varying answers. Which area is high risk for pressure injury? I know. So we didn't get a whole bunch of correct responses on this one, but it is D, it's the coccyx. So the sacrum or the tailbone, okay? That would be a bony prominence. That is where a major pressure area would be. And that is one of the first places, if we're suspecting a pressure sore, that it would develop. So when you're doing your baths, when you're doing your daily care, you're doing a quick skin assessment. And if you see something that doesn't look right, you have to report it to the nurse. Let's go to our next one, team. Question number 9, and we're going all the way to 25. When turning a resident on their side, pillows should be placed A, under their chest only, B, behind the back only, C, between the knees, behind the back, and under the top arm, or D, on top of the head. If you do D, I'm sure we're going to see you on the news. So we're not putting pillows on top of anyone's head. And I see a few B's, but the majority of you chose the right response. You chose C, so great job. And if you need to see these videos Look, we have a whole clinical skills playlist, and it's going to show you how to reposition someone into a lateral or sideline position while utilizing a pillow behind the back, in between the knees, and having them hug a pillow. Why do we do that? Because the inner aspects of the knees could be a place where a person can develop a pressure sore. Remember, bony prominences, anywhere where bone is touching bone or bone is touching bedding. So it's not just enough to turn them off of their back onto their side. You have to make sure that you don't cause pressure in other areas. Why do we have them hug a pillow? Because that's going to be uncomfortable. Their arm won't be aligned. It may be behind them. So it helps to keep them in proper alignment. Number 10, a diabetic resident asks for extra cake at lunch. The CNA should A, give it to them, B, encourage them to follow their diet order, C, tell them no sugar ever, D, ignore them. Perfect, team. Great job. The answer is B. CNAs reinforce diet orders to protect health and blood sugar control. And what does reinforce means? What does reinforce mean? Um, the nurse does the initial teaching, the RN enforces what's already been taught. And so you shouldn't be the first one teaching a patient anything. That's not your role. Your role is to reinforce the orders that are in the plan of the care and to gently remind them, Mrs. Lucas, I know that you want an extra piece of cake. However, you're a diabetic. And so you have to limit your sugar. And now, if she gives you any pushback, that's beyond you. Now, Mrs. Lucas, I do understand, but I'm going to have your nurse come and talk to you. You see how calm you address that? So it's not you going back and forth. It's not a debate. These are the diet orders. You don't want to obey the diet orders. So here, let me get the nurse in here to talk to you. Let's go to our next one. Question number 11. This one is tricky. Thickened liquids are usually given to residents with A, diabetes, B, gastric tubes, C, NG or nasal gastric tubes, D, swallowing problems. Who do we give thickened liquids to? Ooh, we're everywhere on this one, but I'm happy that you're trying. We have A's, we have B's, we have C's, and we have a D. So, yes, somebody who has diabetes could have thickened liquids, but that's not the primary reason. We didn't get them thickened liquids because of for blood sugar control. We gave them thickened liquids because thin liquids would increase their risk of aspiration. So, which one problem with aspiration risk? It would be D, the person with swallowing problems. So, when someone has a nasal gastric tube or a gastric tube, one that's going into their stomach, that doesn't necessarily mean they need thickened liquids. That more than likely means they're NPO. They can't have anything to eat or drink. Okay, some of them will have ice for comfort or maybe some foods for comfort, but usually that is very rare. So if someone has a tube for their nutrition, most of the time they're going to have an order for NPO status. Question number 12. A low sodium diet is commonly ordered for someone with A, heart failure, B, pneumonia, C, diff, or D, staph infection. Hey, thank you for joining us, John. Good morning. I know it's bright and early. It's 8:28 here in Florida, and it's cold, y'all. Look, our northerners, I need you to come back and get your weather. I don't like it. All right, everyone got this correct. So the answer to 12 is going to be A, heart failure, because less sodium reduces fluid retention and helps to support heart function. While a low sodium diet may be beneficial, it's not a requirement for someone who has pneumonia, which is a lung disease or a lung issue. C. diff, which is a bowel issue. They need a bland diet, not a low sodium diet. And if someone has a staph infection, well, that staph infection could be to a sore that's on their arm. That does not necessitate a low sodium diet. Number 13, A resident with kidney disease may need to limit A, exercising, B, fiber, C, fluids, or D, carbohydrates. I know this one's tricky. Someone has kidney disease. Remember, I always talk about it. When a patient has kidney disease, they can't excrete the bad stuff. Their kidneys aren't working. So their body becomes toxic. And if the kidneys aren't working and it can't excrete the toxins and it can't excrete the fluids, well, then we can't be giving them extra fluids because they can't pee it out. They can't urinate it. So, yes, the answer is going to be C. Extra fluids cannot be effectively removed and can result in fluid overload. So, your patients who are on renal diets or if they have kidney failures, more often than not, they're also going to be on a fluid restriction. Question 14. Before transferring with a gait belt, the CNA should ensure A, the belt is extremely tight. B, you can slide 2 fingers between the belt and waist. C, the belt is under the armpits. Or D, the belt can spin freely. Now I want you to think about it when you put on a belt. Do you want your belt so loose that it can just spin around freely? That doesn't even sound right. So, no, it's not D. And we don't want anything extremely tight because that's going to decrease circulation. That's right, team. Great job. The answer is B. So we put 2 fingers anytime that we put anything on a patient, be it a restraint, a gait belt, a dressing. We try to stick 2 fingers in it. When I'm talking about a dressing, I'm talking about a gauze or a roll dressing. We try to put 2 fingers beneath it. That can ensure that they have enough room for circulation. We're not cutting off blood flow. All right, I hope you're enjoying this practice test. Don't forget that if you're part of our channel membership on Florida Training Academy, you can actually download this test. It's printable, so you just won't be able to see it online. You can actually practice with your friends and your classmates. Number 15, which phrase correctly refers to the weaker side after a stroke? Is it A, dominant side, B, strong side, C, affected side, or D, main side? Good luck on your test, Susan. I'm so proud of you. Good luck, good luck, good luck. We know you're going to do well. And that's right, Susan. You answered this question correctly. It is C, the affected side. Affected is the accurate medical term for a weaker side or hemiplegic side. So let's break those words down. Hemi being half, plegic being weakness, tingling, numbness. So hemiplegic, this person after a stroke has one side of their body that is weak or that is numb. So that would be the affected side. 16, mechanical lifts. Mechanical lifts should be operated by A, the CNA alone, B, 2 trained staff members, C, a family helper, or D, a nurse only. And if you've been watching my videos for a while, you know how I rant and, I just want to protect you, our CNAs, our babies, our future nurses. I know we're not supposed to use terms of endearment, but it's the truth. You're my babies. And so I want to do everything I can to protect you and to skill you up, to give you more knowledge so that you will be more confident as you prepare for your nursing exam. So we're going to get you through CNA first. And then once you get your CNA license, you can go farther. But you won't be able to go farther if you make a medical error, such as using a Hoyer lift alone. There's a CNA who was incarcerated. She was jailed for moving a patient by herself. In a Hoyer lift, the patient fell, sustained head injury, and died. I feel so sorry for that patient, but we know these facilities are understaffed. And so that CNA was probably doing the best that she could at the time. Look, you do not move anyone by yourself, especially if you're using a Hoyer lift. It requires 2 trained staff. That could be you and a physical therapist. It can be you and a nurse. It can be you and a PCT. It has to be 2 people who have been trained on how to utilize that equipment, Otherwise, not only could you risk losing your CNA license, you could also risk being incarcerated, and far worse, you can actually cause harm to a patient, and no one wants that on their conscience. Let's go to our next one, team. Question 17. How should the CNA hold the gait belt when assisting to walk? A, grab under the resident's arms. B, hold belt at the front with a loose grip. C, hold belt at the back or side with an underhand grip. D, hold their waist. I know that one's a little bit tricky. I understand. I, some of you all got it. Look, we're not going to hold anything with a loose grip because loose grips sink ships. Your patient could fall. So the answer is going to be C. We're going to use an underhanded grip. And so what we mean by a underhanded grip is this would be overhand. And so imagine you're trying to walk somebody and your knuckles are in their skin. That's going to cause pain. Remember, the belt is already tight enough to where only two fingers can fit in. So an underhanded grip means that your four fingers and your thumb, so thumb on top, four fingers beneath, this is an underhanded grip. That's going to be more comfortable for your patient versus you going knuckles in. Question 18. Before transferring a resident from the bed to the wheelchair, the CNA should first A, lower both side rails. B, lower the structure and raise the bed higher. C, remove all pillows. Or D, raise the stretcher to the same level as the bed. I know what you see in practice. I know what you think makes sense. But no, it's not that one. That's not the answer. Let me tell you why it's not the answer. Imagine you being a post-op patient and your nursing team, your CNA, has put the stretcher lower and the bed higher, and your surgical wounds, your IV, your catheter, everything goes boom because they raised the bed lower than the stretcher. So it should be level. That is right. It is going to be D. Surfaces must be at equal height to safely slide the resident without pulling or lifting. Number 19, and we're going all the way to 25. We're almost done. So thank you for being a part of our channel membership and getting this live CNA review first thing in the morning. 19, a sign of dehydration is A, dry mouth and cracked lips. B, moist skin. C, frequent urination. Or D, increased appetite. Yep, this one's easy. This was way too easy for you all. You know what the answer is. It is A as an apple. So dry oral mucous membranes are a classic sign of dehydration. And so when we talk about mucous membranes, let me actually make this a little bit larger. So dry, crack, those, so the inner aspect of the lip, that's what we mean by mucous membrane. So if the lips are dry, more than likely those mucous membranes are also dry too. Encourage fluids if your patient can have fluids. If they can't have fluids, you can just notify your nurse. Sometimes they have swabs that the patient can use, or we can put oral swabs in a small amount of water with a little bit of ice chips. We're going to make an ice slurry. And then that way they can dip their swab, they can moisturize their mouth, and it helps them keep their NPO status, which means they cannot have anything to eat or drink. Question number 20. A resident on fluid restriction should receive, is it A, unlimited refills, B, exactly what is ordered, C, 2 cups of water per shift, or D, unlimited water but no soda or juice? Your nurse says, or the plan of care says that Mrs. Lucas, who has renal disease, is on a fluid restriction. What does that mean to you? Is it unlimited refills? Exactly what is ordered. 2 cups of water per shift. Or D, unlimited water, but no soda or juice. So it looks like the most of you are torn between C and D. But when someone is on a fluid restriction, the order also indicates the level of restriction. So is it 1,000 mLs per day? That means that over 3 shifts, or if you're in the hospital, 2 shifts, they only get 500 mLs per shift. And so you, the nurse, we have to work together to make sure that we're not giving that patient more than what their restriction is. And so when someone's on a fluid restriction, you give them the exact amount that is ordered. So it may not be 2 cups per shift. It could be a little less or it could be a little more. So CNAs must comply exactly with the ordered fluid limit. The doctor gives the amount for a 24-hour period, and we divide that by an 8 or a 12-hour shift depending on the type of facility you work. Hospitals are usually 12 hours, nursing homes are 8 hours. Question 21. Which diet controls carbohydrates and sugars? Is it A, cardiac, B, renal, C, diabetic, or D, mechanical soft? And I am enjoying spending this time with you. Look, lately I just been working, working, working. That's not a bad thing. But it's just good to be able to, I wish I could see you in person, but you all will not. I don't know why you won't. Just send me your email address so I can add you to the live stream so you can be right beneath me and we could be doing this together. I could be like, okay, Susan, you read the next one. All right. So, question 21. Yes, the answer is C. Diabetic diets, like it'll be a 1,800 calorie ADA diet. So, diabetic diets actually limit the amount of carbohydrates or sugars. So, diabetic diets target blood sugar control by limiting carbs. 22. High protein diets help with A, skin and wound healing, B, reducing fever, C, causing dehydration, or D, controlling seizures. What do you think, team? What do you think? That is right. You have it. You're absolutely correct. It's going to be A, skin and wound healing. So protein builds and repairs tissue, which helps wound healing. As I say in almost every one of our videos, if you have a patient who has maybe they have a skin tear, their skin is thin, they're at risk for pressure injuries, or they already have a pressure injury or a bed sore, and they're not eating their protein because maybe they don't like the way the meat tastes. I need for you to let me know. You have to go notify your nurse because they need protein, but they don't have to get their protein from meat. They can get it also get it from maybe legumes or beans. Maybe we can give them some nuts, but you have to let us know so that it's to the plan of care. And I see that my system's starting to delay a little bit, so I'm going to be off of camera for the rest of the questions. Question 23. Which food is allowed on a clear liquid diet? Is it A, ice cream, B, pudding, C, soft eggs, or D, beef broth? Which food, actually, it's not food, but which food is allowed on a clear liquid, hint, hint, diet? Which of those are clear and liquid? And I know it's a little confusing because you're like, beef broth is brown, but it's brown and clear. So the answer is D. So broths, whether it's chicken or beef, usually are allowed, and also jello is allowed on a clear liquid diet. Again, it must be transparent. The pudding and the ice cream, look, that has milk and some other things. That's not what we're going to start a patient off with eating. If they're on a clear liquid diet, that means there is something wrong. Maybe they had surgery or their stomach needed to rest because they were sick and vomiting. And so imagine if you had vomited yesterday and now today one of the first things we give you is milk. A lot of your African Americans, your people from brown, who have brown complexions, they are lactose intolerant. So if I was sick yesterday and now you give me milk, now I'm full of gas and I probably have diarrhea. So we don't start people off with milk products. It's going to go from, okay, you were sick, you're getting better. Let's start you off with what's going to be the least irritating to your stomach: broths, water, apple juice. And maybe once you tolerate that, that's when we will go to Jello, excuse me. And then after Jello, we can start you on a full liquid diet. And if you prefer something like ice cream, we can give it to you at that time. 24. To prevent choking when feeding a resident, the CNA should: A, lay them flat; B, keep them upright during and 30 minutes after meals; C, keep them upright during and 60 minutes after meals; D, give large bites. Yep, we're torn between B's and C's. That's why I worded it like that, because I want to make sure that you know that you know that you know that I know that you know. It's only 30 minutes, you all. Don't sit them up for 60 minutes. Look, they're already mad at you because you didn't had them sit up during the and up from for a prolonged amount of time. So 30 minutes is sufficient to help prevent aspiration. What is aspiration? That is when the food can go into the food or fluid can go into the lungs instead of into the stomach. And if you lay them back too quickly after eating, some of them have reflux. That means the food can come back up. And when it goes back down, it can go into the lungs. So that is why we ask you to sit them up during their meals and then not to lay them down immediately. They have to sit up to give their food time to digest. Question 25. Pocketing food in the cheeks is a sign of: A, excellent chewing; B, dementia; C, difficulty swallowing; or D, hyperactivity. When we say that someone is pocketing food, what are we talking about? Right, and I see some of you all put in dementia, but just because someone has dementia doesn't mean that they're pocketing food. Pocketing food is usually something associated with someone who has difficulty swallowing. So maybe they have difficulty swallowing and dementia. Correct answer for 25 is B. It's going to be C for the reasons I just told you. Let's see, where is my last question? I think my system froze, but yes, the answer is C. There it is. Pocketing indicates dysphagia and increased choking risk. And look, you all, you know how much I love you and how much I appreciate you. And guess what? Long story short, I actually paid a publishing company to help me finish my book because I'm so busy. And that publishing company did not finish my book. So guess what I had to do, you all? I had to go ahead and finish the book myself. And so I want to show you the book. I'm going to show you our website. Let's see if I can do the screen share really quickly. Let's see if I can figure this out. We're going to do a screen share. Going to share the screen. There. And guess what, you all? When you go to our Amazon store, which is www.amazon.com/shop/Florida Training Academy, which I will have it in the description. Not only can you purchase your CNA equipment kits, you can purchase our new CNA Exam Prep study guide. That is right, you all. it took me a long time because I had to do it myself and I paid someone else to do the editing for me and the formatting and they didn't. So while the book may not be, the perfect editing source as far as the way the pages are laid out, it is full of my information, my knowledge. And so what I want you to do is I want your support. It's $21.99 for black and white. If you want the color version, which that means that the pages on the inside are going to be black and white. But if you want the color version, that one's $24.99. But yes, thank you all so much. Look, that book you're in, because in addition to having it available on keeps cutting out, we're not going to worry about the camera at this point. What we're going to do instead is just wish you all a fantastic day, and I'll see you in the next video. Bye everybody, and thank you for joining Study Buddies and Scrubs and Ambition. I'll see you in the next video. Bye bye.